Assalamualaikum warahmatullahi wabarakatuh. We are from Group 2 from TSP9. We are going to present about our group assignment, which is organ transplantation on heart. This is our fellow group members. There's Abdin, Amsha, Ali Amani, Siti Fatimah Azara, and Farha.
Assalamualaikum and good day everyone. So today I will be presenting about heart transplant. First, what is heart transplant? A heart transplant is a complex surgical procedure where a diseased or failing heart is replaced with a healthy heart from a donor who has passed away. This procedure is usually done for patients with advanced heart failure. This condition can be caused by diseases such as cardiomyopathy or coronary artery disease, especially when other treatments are no longer effective. Next, how does the procedure work? During the surgery, the damaged heart is removed. Then, the donor heart is connected to the major blood vessels. This allows normal blood circulation in the body to be restored. After the surgery, patients must take lifelong medication called immunosuppressive drugs. These drugs help prevent the body from rejecting the new heart. Overall, a heart transplant can greatly improve a patient's survival rate and quality of life. Now, let's look at the effects of heart failure. Fluid buildup or edema happens when the heart cannot pump blood efficiently, causing fluid to accumulate in tissues like the legs and lungs. Shortness of breath, also known as dyspnea, occurs because of fluid buildups in the lungs, making it harder to breathe. Tiredness and fatigue happen because less oxygen-rich blood is delivered to the body cell. Lastly, persistent coughing is caused by fluid in the lungs, which irritates the airway. So that's all from me. Bye.
Next, we move on to anatomy of heart. The heart is divided into two sections, the right side and the left side. On the right side, oxygen for blood enters to the superior and inferior vena cava into the right atrium. From there, it passes to the tricuspid valve into the right ventricle where it is pumped to the pulmonary trunk to the lungs. On the left side, freshly oxygenated blood returns via the pulmonary vein into the left atrium. It moves to the tricuspid valve into the left ventricle. The powerhouse. Notice the thickness of the left ventricle. It must generate enough force to push blood to the aorta to the entire body. Support structure inside the chamber, you will see the chordae tendini, often called the heartstrings, which are held by papillary muscle. This prevents the valve from flipping. Now we move on to homeostasis. First, the myocardium. The myocardium acts like a primary driver of blood pressure. By adjusting the force of its contraction, it ensures that even the furthest tissue in your body receive adequate perfusion and oxygen. Second, the valves. Homeostasis requires efficiency. The valve, tricuspid, aortic, and pulmonary ensure unidirectional flow. This prevents blood flow, making the systematic circulation energy efficient and consistent. And lastly, the SA node, often called the natural pacemaker. The SA node manages the heart rate. Whether you are sleeping or sprinting, the SA node sends electrical impulse that tell the heart how fast to beat to meet the body.
Alright, I will explain the heart transplant procedure step by step. The first step is preparation. The patient is placed under general anesthesia, so they are fully unconscious and feel no pain. Then the patient is connected to a heart-lung machine. This machine is temporarily takes over the function of the heart and lungs during the surgery. The second step is to remove diseased heart. The surgeon opens the chest carefully to assess the heart. The damaged or diseased heart is then removed, leaving the parts of the atria to connect with the new heart. The third step is to insert donor heart. After that, a healthy donor heart is pressed into the chest. The surgeon connects the major blood vessel to ensure the proper blood flow between the body and the new heart. The fourth step is the restart the heart. Once everything is connected, the heart is restarted. Sometimes an electric shock is used to stimulate the heart so it can begin beating normally again. And the last step is closure. Finally, the chair is stitched and closed. The patient is then transferred to the ICU for close monitoring and recovery.
So, I will explain about physiological adaptation after a heart transplant. First is the immune response. After a heart transplant, the body recognizes the new heart as a foreign object. Because of this, the immune system may attack the new organ, which can lead to rejection. To prevent this, patients need to take medications such as cyclosporine. These drugs help suppress the immune system and reduce the risk of organ rejection. Next is body adaptation. The new heart may beat faster at the beginning and function differently compared to the original heart. However, over time, the body gradually adapts and the heart starts to function more normally. There are also some risks. Patients have a higher chance of getting infections due to a weakened immune system. There is also still a possibility of organ rejection and they must go for regular medical checkups. In conclusion, the success of a heart transplant depends on how well the body adapts to the new heart.
Next, I would like to present about the Islamic view on organ transplantation. First, in Islam, saving humans' life is very important. This is based on Quran, Surah Al-Baqarah, verse 5-2, which said that whoever saves a life, it is as he saved all mankind. This shows how valuable a human life is in Islam. From Islamic perspective, organ transplantation is generally permissible, harus, especially when it's done to save a life, reduce suffering, and fulfill medical necessity, also known as darurah. However, there are several conditions that must be followed. First, there must be consent from the donor or their family. Second, the procedure must not harm the donor. Third, buying and selling organ is strictly prohibited. And lastly, it must be done only for medical necessity. Overall, organ transplantation is allowed in Islam as long as it follows ethical and Sharia guidelines. Finally, focusing on heart transplantation is very important because it can save patients with severe heart disease, improve their quality of life, and give them a second chance to live a normal and healthy life. However, patient needs proper medication to prevent organ rejection. In conclusion, organ transplantation aligns with Islamic value as it helps preserve and save human life.